Hi, and welcome to Inside Pleasantville School District. I'm Emily Rubin Persons, your host and Board of Ed trustee. Today, I'm sitting here with our district physician, Dr. Roye, and we're going to learn all about the ins and outs of reopened school with masks and testing, hand washing, all these kinds of things. So first, welcome.
Thank you. Good to be here.
And what is a district physician? I don't think a lot of people really know that we have a district physician.
Yeah, well, according to New York State Education Department, all districts need to have some sort of a medical director. And there are some districts that are larger than others, and so they have someone who is on site and they offer medical care. But for a smaller district like Pleasantville, I'm available for consultation for the nurses. I work closely with them to help establish protocols, to answer questions, and little things like concussion clearances, and then certainly if there are any kids who need help with physicals, I'm available.
Okay. So you do some exams if needed. You work with maybe the athletes if there's some concussions and helping the coaches with those protocols and things like that.
Yeah.
Wow, that's interesting.
We're fortunate. We have a great athletic trainer who is wonderful. So I'm kind of here more for support lately because he's been fabulous.
That's great.
Yeah.
That's great. And I believe you're also have children in the district.
Yeah, I have 2 of my 4 left in the district.
Okay.
2 have graduated, and I've got a high schooler and a middle schooler.
Okay, so you're very much on top of all of the things that we've been going through in getting ready for school to open, and I would imagine you want your kids to be going to school, so it's so great to have you as the physician as well as a parent to make sure we're doing all the things that we're supposed to be doing.
Yeah, no, thank you. It's been a ride.
It's been a ride. So I guess there's so many different questions. I guess to start with, and I know we do have a lot of information on the website, but just very briefly, what are some of the signs of COVID and how is it different in children compared to adults?
So children have been, we think, less affected by COVID, which has been wonderful. But there are probably a lot more children out there that are asymptomatic or who are having very mild cases. And for the most part, that's been wonderful for us as pediatricians because we really haven't had to deal with a lot of really sick kids. But those symptoms can range from anywhere with the typical adult symptoms, which are cough, shortness of breath, and fever, to milder symptoms like nasal congestion, runny nose, sore throat, headache.
Which is what kids get
it's pretty much
all the time?
Anything that kids get during the school year.
Right.
Yeah, so
even allergies. So it could even look like an allergy.
Exactly. So it's definitely put a layer of complication for kids.
So if your child wakes up in the morning and they have a runny nose or something like that, a light fever, and we're going to be doing the fever testing the temperature testing every morning, what should a family do?
So my first recommendation right now, at least, is don't panic because we have such a low infection rate in the area right now. So, just because your child is having some mild symptoms does not necessarily mean they have COVID-19. There are plenty of other childhood illnesses and viruses that are out there. But that being said, we're also trying to keep, your children as well as other children in the school safe. And so if your child is not feeling well in the morning, you need to keep them home.
I think that's a very good piece of advice. Don't panic. It's most likely nothing, but if they do present with some symptoms, stay home. Call the doctor, see what the doctor says. Maybe you have to go in for an appointment. Maybe it's what's it called when they...
A virtual visit.
A virtual visit.
Yeah. It's like we're in the future now, so we're doing a lot of telehealth.
Well, it's not, if you're monitoring the symptoms, it keeps things easier than having to go into the office.
It has been very helpful with that, exactly. Because we have, we're trying to really decrease volume in offices. And so if you're able to do a visit via telehealth, which we can get a lot of information from that, then that really can be helpful. But we've had quite a few kids over the last week or so in my practice who have had pretty good fevers, 103, right? And kids are starting to get their normal childhood illnesses, and I will have to say, no one has tested positive.
Okay, good.
So we're still in a good spot.
Right. I'm glad we live in a low risk state. Okay, so let's talk about hand washing, sanitizer. We've got a video on the website that shows the correct way of washing hands. So have we been washing our hands incorrectly for like the last 100 years?
Probably, probably. I mean, really the key for hand washing is actually friction.
Friction.
And, for the most part, usually you run over to the sink, you quickly put some soap and water on, you rinse off and you're done.
Or no soap.
Or no soap.
How many people don't use soap?
Rinse? Exactly, exactly. So the key is to really, if your hands are soiled, you want to rub. You want to get every surface. You want to get in all the nooks and crannies. And you want to do it for 20 seconds. Mm-hmm. And, that time frame has been shown to be at least what we think is most likely the chance that we're going to get rid of all germs, whether it's bacteria or viruses.
Mm-hmm. Mm-hmm. And then what about hand sanitizer?
So hand sanitizer actually can be really effective if it's at least a 60% alcohol-based rub. Mm-hmm. And again, if you're using friction.
Friction, I like that word,
yeah.
friction.
So you gotta rub until it...
You gotta really, and I know when you put hand sanitizer on your hand, you really do have to get in there and rub it. Otherwise, it kind of sits
sticks
on your hands
exactly.
for a little bit. And then I would imagine, even in the hallways, like in some of the information talking about, no touch doorways and things like that. But just even walking up and down the stairs, like maybe don't use the stair railing, use your elbow, which is something I've done for years, when you go down into like the New York City subway system. So, maybe encouraging the students to...
Exactly.
If they need the handrail to just kind of lean against it with their arm as opposed to holding it with their hand and things like that, they can just kind of keep their hands
right. It's those frequently touched surfaces you want to try to at least avoid if you can.
Right. And we're sitting here with our masks, right? Because that's the world that we're now living in, and showing everybody that we can talk and have a conversation. So what about the masks versus the gaiters and the types of masks? And, some people have to wear the surgical. Like I went into a doctor's office and they wouldn't let me keep my cloth mask on. They gave me the surgical mask.
Interesting. Okay.
Yeah.
So really, the reason that we're wearing masks in the community, right, is to prevent the spread of our own respiratory droplets. Mm-hmm. So, and it's a great way to kind of get kids used to doing this is by saying, most kids have a sense of what germs are. Mm-hmm. And so, letting them know that, I wear my mask to protect you and you wear your mask to protect me. Mm-hmm. And basically what we're trying to prevent is the little tiny respiratory droplets that naturally come out when we speak from crossing the room and getting someone else infected. Right. So the differences with masks, the CDC recommends that the mask should be at least a 2-ply mask. Mm-hmm. It should fit comfortably. Mm-hmm. It should cover all the way to your ear without gaps. Mm-hmm. It should go under your chin, right? And you should keep it on.
As opposed to it being down here, as opposed to keeping your nose open, because you could sneeze.
Yeah, and even just the act of breathing, there are small little respiratory droplets. I mean, they can be as small as 20 to 500 micrometers. Wow. And there have actually been some really neat scientific experiments with high-speed video that show, just in the act of speaking, how many particles can be expelled.
Exactly. I mean, we were kind of laughing before about the scenes in the Hamilton, because Disney showed Hamilton on Disney Plus, and I had not seen it on Broadway, so I got to see it here on the TV, and you could see as the king is singing, he is just spitting all over the place.
That was very timely.
We were all laughing about that, but we've also had situations where you're just talking to somebody and it's like a little So, but I think the important thing that maybe people don't understand that you said is that it's protecting. Like if I have symptoms and I'm wearing a mask and you're not wearing a mask, at least I'm protecting you. Right. Because I've got the mask on. Right. So it's keeping it in. Right. And then if I'm not wearing a mask and I've got the symptoms and you're wearing a mask, you could still catch it because the droplets are all around.
Exactly. So and unless you're wearing an N95 mask, which is fitted to you, if you're wearing it properly, it's test fitted, it's no gaps, it's not permeable. So for what we're trying to do in the community, it's decreasing the amount that can be, that you can be exposed to.
And then the gaiters, for people who are exercising, I've noticed a lot of them wearing those gaiters. They could just quickly pull them up.
Right.
What about those for kids in school? Are those as effective?
Yeah. So the CDC right now has put cautionary advice on gaiters, and just mostly because they don't know the effectiveness of it. Most of them are usually one ply. I think kids might tend to fidget with them more too. For situations when you're in school and you're in a space for a longer period of time than just kind of running by on the street, they're not really recommended as well.
Because they must not, because they fit around your ears. Like mine actually goes around my head.
Right.
Yours are going around your ears.
Right.
But the gaiter just kind of, like I ski, so the gaiter just kind of goes up and it's always falling down.
It's always, exactly. And you tend to touch it more. And the idea is when you wear a mask, we're trying to also have you avoid touching because in effect, this is contaminated, right? So if anything's been hitting your mask or you've been exposed in any other way, the outside of your mask is contaminated. So, that's one of the things also to try and teach the kids before they get to school is what we call mask hygiene.
Right.
How to take your mask on and off by just touching the ear loops.
Right.
Washing your hands before and after you remove your mask.
I'm touching it now as we're talking because one of the things I've made a lot of my own masks and I've realized I needed to put a little dart on both sides which provided for more of a cup.
Yes.
So that it wasn't resting exactly against my mouth while I'm talking. I see you have the darts on yours so that it creates that. And a lot of the masks don't have that. They just kind of are flat
and then
against
they kind
your
of
face.
suck in as you talk, and so
it's too much. So for me, I need to have these extra darts. But I'm also seeing the more you talk, the more so I might need to adjust the strap up here.
Right, it moves around, exactly. And then if you wear glasses, you want to be able to kind of pinch it so that you don't get airflow that comes up.
I think I saw that you can get those little bars.
Yes.
I think I saw that you can get those separately.
And they stick
and they
the
stick.
inside.
So that's something I need to do because as the more I'm talking, the more this is moving around.
Yeah.
So that's a good example for me to help with people who, because I think of the teachers who are going to be wearing these all day.
Right.
Right. Okay. So, all right. So let's move on to the next question, and that is all about the health screening. So before the kids, we're talking about the kids need to have a health screening before they come to school. Have their temperature taken. We're going to have a new app, which I'm sure again is going to be up on the website with instructions on how to do this. So talk a little bit about what that pre-screening before school is and all of that.
So that's actually a really important part of school opening. And basically what we're doing is we're trying to prevent kids who might have had any sort of exposure or any signs of illness from actually coming into the school at all. It's done in numerous ways. We have an app which the parents will be able to access every morning, answering a few questions. Does your child have any of these particular symptoms? Have you traveled into any high-risk areas? Have you been with anyone who has been diagnosed with COVID or is expressing symptoms of COVID? And then the last one is a temperature screen. Right. And if
so you
all
have
of
to
that,
put the temperature into
you have to enter it into the app, exactly.
Good.
So so that way, what we're saying is basically like stop and think before you send your kids to school. Which everyone's busy. Everyone has things they have to get to school. Part of the reason we have kids in school, we have to work. But it's a way of kind of pausing and saying stop and think: is your child well enough to go to school today for their own safety as well as for the safety of all the other people in the school?
And what if the temperature is 100 and you enter that into the app and you give your kid some Tylenol or Advil or whatever it is that you use and you still go to school, what will happen?
So first of all, if you enter 100 into the app, it will flash and it will tell you, please do not send your child to school. Exactly. You will get the little warning sign. So please don't send your child to school. Keep your child home. If your child does wake up and feels unwell, The first thing to do right now is not to panic, right? We have such a low caseload right now. The infection rate is low, likely it's another illness. However, we don't want your child in school.
Right.
Because you know what? We don't want them giving whatever other child illness there is too.
Right.
So your child should stay home. Ideally they should see their pediatrician.
Right.
And, and they need to, right now, the guidance is pretty strict.
Yeah.
So there's going to be a lot of kids who need to stay home and who need to,
and if they don't
get
fill in,
evaluated.
right, and if they don't fill in the if they don't do the app and they just show up at school, we're going to test them once they get to school,
right?
Correct?
So no one will be allowed in the building without having completed the app.
Right. So what happens if it's 12 o'clock in the afternoon and all of a sudden a student doesn't feel so well? Will they be immediately sent home once the nurse takes their temperature? Because it used to be that you would just stay in the nurse's office for a while.
Right. So if they do show that they have a fever at home, they need to be isolated right away. And the school has worked out areas where that can happen. And the parent will be called and asked to pick them up.
Right. So I think what's going to be really important is, with all of this, is that our emergency contacts are up to date. Because I know, I'm guilty of this. I actually had one of my older sons as the emergency contact, and he was up in Vermont. So that would not have, that really wasn't a good emergency contact. Sometimes people use their mother-in-law who's 3 towns over or something like that. So that might not be, we really need to make sure that everybody has a local contact, somebody who is home, in case, because if you are working, you're a doctor, you're in with patients, you might not be able to walk out the door right away if your child is sick, so you're going to need to rely on. So I guess that'll be something the school will have to just make sure everyone stops for a moment and thinks, okay, who really, it shouldn't just necessarily be your best friend, it should be somebody who's really around to come. Right. Yeah, that's going to be really important. And then, fresh air. There's a lot of talk about the HVA system and exchanging of air and fresh air. Of course, probably fans are not recommended. Yeah. So what's the deal about fresh air?
So fresh air, basically, we're talking about respiratory droplets, and we're talking about even the possibility of some aerosolization of the droplets, meaning that it can kind of hang suspended in the air for short periods of time. And so fresh air basically is allowing air to exchange so that you don't have air just sitting in one space. And that's why we've shown that, it's been better to do things outside, as much as we can. Gym will be held outside, if there are any sort of like singing or other groups, to be held outside. The whole kind of concept of the ventilation systems basically is what you're doing is you're exchanging air. And Pleasantville, it sounds like, has done a really good job with that.
Right.
We're encouraging keep your windows open as long as you can. I would recommend, kids come to school in layers because it might be a little bit cooler this year. But they'll be getting fresh air.
It's better to have the fresh air. It keeps your brain alive a little bit more.
Yeah,
sometimes the rooms can get a little stuffy.
Sure, absolutely.
That's good. We're lucky that we live in a state where we have low risk, and I know my son goes to school in Boston, so because we're a low risk state, he doesn't have to get tested before he gets to school. But some families are talking about, well, maybe all students and staff should be tested before school starts. What do you think about that?
Yeah, so that's tricky, especially for a public school where people are going in and out. A COVID test tests you at that moment in time. And so when you have your tests, if you test negative, you were negative at that point, but we don't know what you are the next day or the following day, depending on who you come in contact with. So to test everyone and to use resources that we are going to need for kids who maybe have been exposed or who develop symptoms, it's actually a very daunting procedure. So right now, all of the guidance from CDC to the Department of Education is saying that do not test before school, but they are suggesting that there be a lot of testing if kids do have symptoms.
Sure, and if you're, we've all been, in my household, we've kind of been quarantining pretty much all the way through, But I guess between now and when school starts, or even after, try and keep your movements a little less, maybe not having too many social gatherings, just to reduce that
right. If we can keep our community infection rate low, then that's just going to help keeping the schools open. I mean, that's one of the things that we're, cohorting in school. We're trying to keep your interaction with other people as minimal as possible, and that is part of kind of a whole risk mitigation policy.
Was leading right into my next question. What do you feel about how Pleasantville, in terms of our risk mitigation?
Yeah. So the whole concept of opening schools, we have to understand that we're not going into zero risk. It's impossible. What we're trying to do is we're trying to mitigate that risk and keep it as low as possible. And we do that with a number of layers. We do it with the masks, with physical distancing, with volume control and cohorting, hygiene, disinfecting, and keeping kids home if they're sick. So all of that, I think, putting that all together, I think Pleasantville has done a really amazing job. And there, it's hard. And it's fluid, and right now we have guidance for today, but that guidance might change tomorrow, and infection rates might change. And so, while it's something that's really hard, we all need to be flexible and understand that, just because we say, the rules are this today, they might change.
Fluid is a word that's been used a lot over these last couple of months. And, I had Steve Chamberlain here talking about all the things that he's doing in the buildings to get everything up to speed with the cleaning. We now have those cleaning machines. We now have 6 of them. So cool. That's like a Ghostbusters kind of a thing. When we saw one of the videos with them, more of the clear protection around desks and things like that. So there is just so much that. And all the training that we've been doing. So I feel comfortable. I mean, I know, there's a little uncertainty about extracurricular activities. I know that the principals really want to try and make for as much as possible, but I would imagine, you're a doctor and you're a parent in the district, and how do you feel? Yeah,
you know what, I feel comfortable sending my kids to school. I think, there are so many advantages to in-person. It's not going to be the same, and it's going to be different. But I think that, we have such an incredible district and community. I think everyone is doing their best, and I think we're going to figure it out. We're going to get through it. And there's going to be some bumps in the road, but... Definitely.
But, the flexibility, some kids are going to do great having only 3 days a week with live instruction. And that does have a lot more structure than we did last time. And having 2 days a week where there's a little bit more flexibility, maybe they'll buddy up. Maybe it'll encourage students to reach out to their friends a little bit more than they did before, to have some buddy systems and things like that. So
no, there's a lot more planning. The spring was just like, it was
across the country.
The country. It was really, really hard, but I think they've put a lot of thought into things. And again, for everyone, every child is different. Every family is different. Everyone has different risk factors in their home, and so that's what everyone needs to consider. For each individual child and family. But I think they've done an excellent job so far.
All right. Well, we're just about out of time. Is there anything you think we haven't covered here? I think we did the hand washing, the masks, testing, risk mitigation, fresh air.
I think we've covered it all. I think it's just, everyone's got to just work together. It's that whole kind of, it takes a village. And, I think if we're all smart and we all wear our masks and we do the right thing, we're going to get there a lot faster than if we don't.
I agree.
So I think that's really
all right. Well, thank you so much for joining us today.
It was fun. Thank you.
Okay. Take care. So now here we are with Superintendent Mary Fox Alter to take us full circle. How are we doing?
So we're doing well, and I definitely want to thank the Board of Education and the community for their support as we enter into what we have called a soft opening of schools. As a nation, we have suffered a trauma. We've suffered it on a state level, on a county level, and then as a community. And it's really important that that soft opening addresses that. So we've taken care of health and safety protocols. We've addressed the nuts and bolts of filters and temperatures and screenings. But the next stage of our opening, which will start this week with our teachers and then next week with our students, is really to make sure that we've addressed this trauma that we have faced. This is a complicated time and a complicated period. So the expectation, and it's been a while since children have been in the schools, so we want to start our year off with a tiered support. We want to make sure that we have different advisory groups in place in the schools. We want to ensure that children have this time to connect again, to get familiar, and to get into their routines before we go into the content area. So the National Association of School Psychologists speaks about how creating small advisory groups, making sure that you have small meetings where kids can speak about their individual circumstances and share information, all with the support of professionals before we, again, as part of our soft opening, before we dip into the content.
And just even, I know that, for example, technology pickup for the students is tomorrow. That starts tomorrow. So just even that will be exciting, I think, for the kids to go in, get their device, have a boot camp on the new technology, and that will just begin. And I know the teachers are in their boot camps to learn their technology, so that, you know, it's that excitement. There is a little tentativeness, but I think for the most part, the beat around town is excitement to get the kids back into school. And I love that we have them coming in on the Thursday and Friday. So they're each coming in one day, see everybody, see their teachers, go through the lunch process, go through the, you know, some of those things that, you know, are part of the day. So I think,
as well as attending some of those virtual meetings that will be taking place, some of the virtual boot camp meetings. So it's this blended hybrid approach towards trying to get back to normalcy as best we can.
Right. And there's so much that everybody has learned on just even being comfortable with virtual learning, right? And, you know, for the teachers and for the students and for the families. You know, and some of the other big things that have happened with just even our food service. Like, we have had so many unbelievable new things. First of all, you decided to do, or whoever, the team decided to do the new software technology well before COVID. So new software. Now we're doing food service in-house, which I think I actually kind of like that idea.
We do too, but again, it's being able to pivot and being able to, you know, work with the Board of Education. You guys have scheduled weekly meetings now as we attempt to address these needs. And I thank Tim Whipple for thinking out of the box. You know, we couldn't get any of the big food service providers to do it in a way that would be cost effective for our families. So this is a great approach towards this. And again, lunch will be grab and go, but
that's okay.
We'll be here.
That's okay, grab and go. And I think, you know, the flexibility and, you know, some of these words, flexibility is really important. And when you think about it takes a village and you know, community and flexibility, look at all the committees from the middle school, the high school, the elementary school, your team. You had parents, you had teachers, you had students. There were so many people all summer long meeting to talk about education, instruction, safety. What were the four? There were 4 committees for each school. I can't remember because I was only on one. The wellness, communication, parents communicate, you know, so there were so many people involved. So you're getting all of that input, which I think has been really helpful.
And again, as we have said at many a board meeting that, and I put it out in our K-12 alerts, that this is a challenging time. This is, nothing will beat full in-person instruction, but we believe that this is our best approach towards maintaining health and safety first of students and staff, and yet addressing those important instructional needs of in-person instruction. So we'll see what happens in September. I'm excited about this week and next week. A lot's going to take place.
Lots going to take place, but we've got, you know, good communication. Again, the website, within the website has lots of information about COVID, all the FAQs. The principals have been putting out great emails with additional FAQs and videos and conversations.
And we're lucky to have Dr. Roye.
And Dr. Roye. And also, you know, what also came up, I noticed in all of these various meetings and board meetings and whatever, is the community partners that you and the principals have with reaching out to other superintendents, other principals, to make sure that you're collecting all the information. Because every district is different. Every district has a different number of students, different types of buildings. So, you know, it's like comparing recipes. Okay, you know, well, I really like this, so what do you do? Oh, let's figure out what's going to work best for our community.
And we're in this together.
We're in this together. So, you know, look, I think the fact that Dr. Roye was, she almost didn't want to meet inside. She was concerned. I mean, she's a healthcare professional. She said, I don't know if the room is going to be big enough. I said, don't worry, the room is plenty big. We are social distancing. We'll be wearing our masks. Her kids are in the district. She's more than happy to have them come back to school. She feels 100% confident, as do I, to have my child back in the school. I think he's enjoyed the independence, and he, I think, is going to enjoy him personally having a little bit of that flex time, but I know he's also ready to get to work as a 10th grader. So on those 8 topics, is there anything else that was a biggie, or that we...
Oh, they were all very challenging, and it is clearly a complicated time, but the only way you can do this is with a team. So this community should be very proud of its Board of Education. You guys have been fantastic. We're doing the best we can. We are preparing for the worst, hoping for the best, as you have said in public many a time. I'm excited about the start of schools, and, you know, fingers crossed. Keep the mask up, Pleasantville. Maintain your social distancing. Proper hand hygiene. And let's have a great start of a school year.
I think we're ready. I think we're ready. So, all right then. So thank you for joining us on this edition of Inside Pleasantville School District. Thank you for Dr. Roye for taking us through all the health and safety issues of hand washing and mask wearing. And thank you to the captain of the ship, our Superintendent Mary Fox Alter, for spearheading all of us through this incredible time. I can't think of anyone better to take us through this. So thank you very much. Enjoy this last week before school starts, and look forward to seeing us in our next edition of Inside Pleasantville School Districts. Have a great day.